We have a leadership that has been very silent about what is taking place. And when you're silent, it says that you're in agreement. When you're in agreement with what's taking place in our country right now, and you vote for things like Medicaid cuts, you vote for healthcare staffing cuts, that means you're in agreement with it. And you're silent because you don't want to lose your position. And I want to make the connection with healthcare and within the healthcare system, because a lot of times in leadership, you hear the saying, just play the game. You got to play the game. Well, that's how you play the game. Why do you have to play the game? Think about 4 more years of playing the game so that you can have your cushy Senate position, or you can have your cushy billionaire business while the rest of the country suffers. Make that make sense.
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started.
Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. Now, let's just get right into it. Silent no more. And I'm sure you guys have seen it. I know over the weekend, it looks like thousands across the nation came together, unified for the No Kings protest. So let's talk about this. And this is what America is about, right? We are not a country where we have a king who wants to run this country like a dictatorship. And these are the moments where I am proud to say I love seeing the country come together, different cultures. It didn't matter. Everyone is realizing and seeing what's happening. And we're getting to a point where we can be silent no more. We realize, right, that we can no longer be silent, because when you stay silent, you stay complicit. Listen, when you have a president who has a $45 million parade, but yet you're laying off government workers, people are losing Medicaid, people are losing insurance, all these funding cuts to healthcare, to CDC, research, but you can spend $45 million on a parade, and for what? So, and I'm not sure if there's even a realization that this was a slap in the face to you. This was your country telling you, we don't want you. And more than that, last week, I talked about voting, right? I talked about it in the newsletter. Your vote matters. There was a lot of people who voted for this. And there's a lot of people who say, well, I actually didn't vote for this. I didn't think he was talking about me, or I didn't think that my father would be deported. Why not? Project 2025 was spelled out clear as day, and you chose not to believe it. You chose to move forward with your decision. And now we're living with the decision, and we're 5 months in, and the country is in a position where other countries don't even want us to visit. But I don't want to get too far off topic about that. It just saddens me, and it points to our leadership. We have a leadership that has been very silent about what is taking place. And when you're silent, it says that you're in agreement. When you're in agreement with what's taking place in our country right now, and you vote for things like Medicaid cuts, you vote for healthcare staffing cuts, that means you're in agreement with it. And you're silent because you don't want to lose your position. And I want to make the connection with healthcare and within the healthcare system. Because a lot of times in leadership, you hear the saying, just play the game. You got to play the game. Well, that's how you play the game. Why do you have to play the game? And I attended an event some time ago, and we were having a conversation, and a behind the scenes conversation. It was during one of the breaks. And I forget how the conversation actually started. And the gentleman said, well, you got to know how to play the game. And that's the problem with this generation. They don't know how to play the game. A young lady stepped in, and her response was, and I couldn't really tell what generation she was from, but not that it mattered because she made a great point. Her point was, well, why do I have to play the game? Right. And she was right. And it's funny because what she was saying, I was thinking the same thing. Why do we have to feel like we have to play along, right? Why do we have to play a game? Right now, what's happening in this country, there's no time for playing the game. Like, we have 4 years of this. Like, think about 4 more years of playing the game so that you can have your cushy Senate position or your cushy political government position while the rest of the country suffers. You can have your cushy billionaire business while the rest of the country suffers because you chose to play the game. And explain to me how that makes sense. Like, make that make sense. And the same thing happens in healthcare. And I'll give you an example about staffing, right? Now, I can remember working in leadership, and you were not supposed to talk about staffing. And I'll tell you what I mean. You were not supposed to talk about you being short staffed. Like, that was just not a term that you used in leadership. And I'm giving an example from one facility in particular that I worked at. But in general, you pretty much don't say that word, short staffing. You don't refer to staffing as any issue in healthcare, not as a leader. There's always any other reason, but you can't say staffing. And the one time you say staffing, you're not drinking the Kool-Aid, right? And I'm just going to put it that way. The one time you refer to staffing, you're the problem, and everything else can unravel from there. Because guess what? You're not playing the game. So you have to look at every other and I can tell you this because I was programmed the same way, right? Why did this happen? Why did that patient get that pressure injury? You can't say that because we have 10 patients or okay, maybe I'm exaggerating a little bit with the 10 patients. Not that 10 patients doesn't happen anywhere, but we can't say that patient got a pressure injury because there was 30 patients on the unit with only one nursing assistant and only 4 nurses, right? Like, we can't say that. You can't refer to that. And it's just really frustrating. And it can just become very overwhelming and frustrating as a leader to have to constantly play the game when people's lives are at jeopardy. And, last week, I know I referenced my book, Confessions of a Nurse Executive. And I want to read a part of the book because there's a chapter in my book that is called Leadership. And when we talk about playing the game, this chapter really gives a hint of what I mean about what can happen when you play the game, when everybody's just playing the game and no one's actually speaking to what actually should be done. And I'll tell you what I mean. So here we go. And I know I'm reading excerpts. The book is available. I'll make sure I'll put the link in the show notes. But I wanted to read the excerpt and then just talk about it a little bit. The assistant manager was found in tears being consoled by a few of the nurses. She realized she had not connected the paths to the defibrillator and feared she would be blamed for the patient's death. She said, "You don't know this place. They're always looking for a scapegoat." It was then that we learned that the nurses had only attended an ACLS class months before the opening of the brand new unit. Who had placed the nurses in this position? At the time of the patient's death, the director had been in her role for about 5 weeks. The first 3 weeks consisted primarily of acclimating herself to the environment and meeting organizational leaders. Whenever she asked anything about nurse preparation or plans for the new unit, she would be brushed off and consistently told not to worry about the opening and that the move would be taken care of. How could she effectively take on a role without knowing the details of the opening of the unit? She was not comfortable with the responses, which seemed to focus mainly on Press Ganey scores and rounding tactics. Now, for those of you who are currently in leadership roles, you know exactly what I'm referring to. And now when you talk about playing the game, this character could have very well just played along, played the game. But what you don't want to do is play the game when it comes to people's lives, right? And unfortunately, there are times the perception is that organizations look for scapegoats. Something happened. Who was the blame? And I think that like in every industry, someone has to be the fall guy, right? When something huge happens, unfortunately, someone has to be the fall guy. So what people do is they play the game so that they're not the fall guy, right? They want to be looked at as the hero, or they want to be looked at as, or they're silent and they're not saying anything. And that's the problem. And that's also probably why you have hospitals like the one in Albany Medical Center, who was fined. And I'll read that to you as well. You can go to nysna.org and read this. Albany Medical Center fined $375,000 by the DOH after failing to safely staff hospital. After issuing a staffing deficiency report with a record 500 plus staffing violations, the Department of Health issued massive fines to Albany Medical Center. And this is what happens when you're silent. And unfortunately, a lot of hospitals are very silent about their staffing issues. And they're silent about their staffing issues because they don't want things like this to happen. They don't want to get out how they're jeopardizing the community, right? Hospitals, they don't want that. They don't want to be known as the organization that jeopardizes the community, because that's ultimately what happens. And unfortunately, in healthcare, we're made to be silent about these things. Like you're not supposed to go and talk about the staffing issues. Well, why do you think hospitals are going on strike? Like, why do you think nurses are striking like all across the country? They're striking for safe staffing ratios. I mean, amongst other things as well. But staffing has been a huge concern for years and years and years. It's been a huge concern. And unfortunately, a lot of times as leaders, we don't talk about this enough. And we're made to feel that we can't really fight for it. And if we do fight for it, we're the problem. And just circling back to the excerpts in the book, and using the book as a reference, right? When you see certain things or see what can happen when we're silent, and let's use this for an example. The character in the book recognized that there was a problem. You have nurses who were given a advanced cardiac life support class, and now you're told that you can take on this higher acuity unit. It doesn't work that way. I don't want to spoil it, but I say that to say what leadership does is fight for more education, proper training, proper staffing, proper budget, so that the unit can run efficiently. Unit or units can run efficiently. That's what leadership does. If you're just going to be silent and just go along with what you believe is going to benefit you in your role, and you want to be silent so that you can, cover yourself, you're not the leader that your team needs. And sometimes your team doesn't even recognize that, how much you're fighting for them on the back end. And it becomes challenging when you're dealing with an organization that doesn't really recognize or doesn't really know what the staff needs. And to give you a little background, this was a brand new unit for this organization. They had never had intermediate care. So there was only like med surge, and then there was critical care. So there wasn't really a lot of knowledge surrounding what type of patients need to go on this unit, what type of policies need to be put in place for this unit. So this was brand new. And so now this character is coming into this role and has the experience, knows what it looks like to run or, to be included in an intermediate care area, and quickly recognizing that the organization doesn't. So those type of challenges, they're not uncommon. But if you stay silent and just go along with a bunch of people who don't really know the way, that's when you pick up the baton and you take the lead. And you can't be silent. You have to fight for what's needed. You cannot be silent at a time when your team needs you. And if you are, what happens is it can erode inside of you, and it can lead to burnout. Not only for you, it can also lead to burnout for your team. Right? You'll start seeing the signs of they're lashing out. Why are they lashing out? Why are they burning out? Because they're tired. They're tired of working short staff. They're tired of taking on more loads. I've seen nurses who they are brand new nurses, or or maybe they have some experience and they're so eager to learn. And before you know it, they're so burnt out because guess what? They're not getting the support that they need. And now they're ready to go. I have a really good friend of mine. She's been a nurse now for about, I think we just celebrated 2 years for her. And she's already talking about how she's burned out. And to be honest with you, some of her burnout is it comes from staffing. And every organization has their different issues, whatever that looks like. And so you guys know what I'm going to say. If you want to do something about it, what do? Number one, you can't stay silent, because when you stay silent, you stay complicit. I can remember when we were organizing Nurse Shift Change, there were some members of the committee who lived in certain states where you couldn't even say the word DEI. And apparently it would place you in a position where you could possibly receive death threats. Now, I'm not telling anyone to do anything where they feel like their life is under attack. The point I'm trying to make is that I want to talk about what silence costs us. And for me, I don't feel like I live in a state, and even if I did, I don't feel like I live anywhere where I can't say the word DEI. And there were several reasons behind it that I can surmise. One, political, not wanting the movement to be too political. But at the end of the day, we're living in a time where with an administration that's not playing fair, right? Trying to be silent. And that's why I want to talk about what silence cost us. And I want to talk about it because I want to talk about the cost of silence. Silence can be self-protective, right? It can be self-protection in a way, but it can also be self-erasure. So Dr. Lendra, what do you mean by that? Many nurse leaders stay silent because they're protecting themselves from burnout or retaliation or being misunderstood. But over time, silence erases your influence. And I'm guilty of that. I have to say that, there were definitely times when I was silent. And a lot of times for me, it was because I didn't want to be misunderstood. But that's something that actually came from not only healthcare, that's something that I deal with outside of healthcare as well. And that I dealt with growing up, being very misunderstood. And I think I took it into my professional life as well. And even sometimes now, I was on the phone recently with one of the ministers from the church, and she's like, how can I say this? Because I don't want to be misunderstood. And I'm saying, I'm like, oh my gosh, I'm the same way, right? Like trying to say things so that you're not misunderstood. But what happens is when you're silent, sometimes it feels safe, but it's costly when your ideas are exactly what your system needs. The second thing I want to point out, let's talk about burnout. Burnout is not just exhaustion. It's your suppressed voice. Burnout happens when we keep showing up physically, but we're already emotionally withdrawing. And the first thing that goes is our voice. Your voice is a casualty of burnout. And your platform is your first step towards recovery. Now, your platform can be a summit. Your platform can be a book. Your platform can be you starting a podcast. Your platform could be mentoring. Your platform could be your nursing unit. You have to decide what that platform is, but using your platform to elevate your voice, right? Because silence costs you innovation, advocacy for your patients, for your teams, for your business, your opportunities for visibility, for leadership, even income. Every time you stay silent in leadership, you're paying with your credibility, your creativity, and even your cash flow, like even your income. The last point I want to make is that breakthrough requires speaking up, even before you're ready, right? And I'm guilty of this. A lot of times, and I'll give an example in my business, a lot of times, or even starting my business, right? A lot of times we feel like we have to have everything perfect. Everything has to be in place before we can start something or before we can launch something or before I speak to this, I got to make sure I have everything in place. Sometimes you just have to do it messy, right? And again, another reference to the Nurse Shift Change movement. What we say, we're building the plane as we fly it, right? Sometimes that's what you have to do. Sometimes you have to build the plane as you fly it. And when you think about your breakthrough isn't about being loud. It's about being honest, clear, and consistent. When nurse leaders speak, we change healthcare one voice at a time, one story at a time, one platform at a time. And you have to decide what's your platform. What are you going to use and how are you going to use your voice to break the silence? That's a question you have to ask yourself. So as I close out today, if this episode spoke to your silent struggles at all, I want to give you the first step towards your breakthrough. Download the Burnout to Breakthrough starter kit. Now, this is different than the Overcome Burnout download that I have. So this is a starter kit. So this Burnout starter kit includes your burnout archetype quiz, some reset tools, and a summit checklist to help you start using your voice again. I'll put the link in the show notes so that you can download your Burnout to Breakthrough starter kit. And if you're ready to build a platform, I have a huge announcement coming up, and I want you to join the wait list for the announcement. You can subscribe to the Health and Wealth Expo live.com subscriber list, and because that list is going to receive the announcement, so you can subscribe to Health and Wealth Expo live.com, and you can subscribe and join the email list, and that way you'll be the first to learn when we make the huge announcement, and you can get on the wait list that way. So until next time, make sure that you stay educated, stay inspired, and stay empowered.